very high percentage of people who have high blood pressure are not aware of it. And a significant percentage of people who know it, their numbers are not where we want them to be.
Yeah.
And here is the problem. Here is a challenge. If you have abdominal pain or if you have a headache, I don't really need to sell a Tylenol to you.
Yeah.
You are going to go somewhere and get something.
Yeah.
But the problem with things like hypertension is it's called a silent killer. It's not going to cause any symptoms till it is too late. But look at the high blood pressure. It can affect you from head to toe. It can increase the chances of stroke. It can cause blindness by causing retinopathy. It can increase chances of heart failure, heart attacks, peripheral vascular disease, kidney failure, so many things that can happen. So important thing is to identify it and be treated for it.
Long-term high blood pressure can cause permanent damage, can't it?
Absolutely. You want to identify and treat it before the damage is done.
How often should a person get their blood pressure checked?
Typically, if you're seeing your physician every 6 months, every 1 year, they check your blood pressure, that is adequate. But if you have high blood pressure, then you need to check it more often. Or if you are on medications for high blood pressure, you need to check it more often.
Let's talk about diet and exercise as they are concerned with high blood pressure. How much are they affected in that case?
The study came out, JNC7 came out in 2003, and people actually did studies that if you lose weight, you eat right, low salt diet, exercise, it can bring your blood pressure down by about 5 to 10 points. And even if you are on blood pressure medications and your physician provider thinks you need to be on medications, diet and exercise still helps. It's high blood pressure, properly treated, is perfectly compatible with you living to be 110.
There you go.
And number two, this is another concern many of my patients have. When I see them, their blood pressure is very high. I want to give them a medication. They say, "Doc, I know I have 50 pounds to lose. I have gained them over years without even knowing it. Let me do that, and let me come back to you." I always tell them, you know what? Let me give you this medication. Let me treat your high blood pressure. God willing, another 6 months, 1 year, your weight is down and your blood pressure comes down, we can always take you off them. Exactly. Blood pressure medications are not something your body gets used to. If you don't need them, you can stop them.
There you go. How can people contact you?
Our number is 702-473-5333, or they can Google our Smart Heart Care is our practice name, or you can go to our website, 4smartcare.com. That's number 4.